Welcome to the product video for Allstate Health Solutions Cancer and Heart Stroke Plan, a plan providing cash benefits to help with out-of-pocket costs after a cancer, heart attack, or stroke diagnosis. In this video, we introduce you to our Cancer and Heart Stroke product. We will cover its plan options, details, including availability, eligibility, and enrollment options. We will also explore some resources that Allstate Health Solutions makes available to you as an agent, as well as resources for your customers. Because the human body is remarkable and resilient in so many ways, people don't always anticipate a life-threatening illness like cancer, heart attack, or stroke. However, over 1.8 million Americans were diagnosed with some type of cancer in 2020 alone. Additionally, every 40 seconds, an American has a heart attack, and more than 795,000 Americans have a stroke every year. Of these strokes, 140,000 are fatal. As a result, Allstate Health Solutions designed our Cancer and Heart Stroke product to help your customers face the unthinkable with confidence. Allstate Health Solutions Cancer and Heart Stroke plans pay customers a lump sum cash benefit for their first ever diagnosis of cancer, heart attack, or stroke. Plans pay on top of benefits from any other plan. You and your customers can choose from benefit levels that range from $25,000 to $75,000. Additionally, guaranteed issue plans are available. Furthermore, cancer and heart stroke plans have no network restrictions. Your customer can go to any doctor or hospital they like. Now let's go over Cancer and Heart Stroke's plan design. We will discuss plan benefits as well as covered conditions. Cancer and Heart Stroke has 4 available benefit levels. The $25,000 and $30,000 benefit levels are guaranteed issue, while the $50,000 and $75,000 benefit levels are standard issue. Cancer and Heart Stroke's cash benefits go straight to your customers to use any way they want, to help pay for their medical bills, mortgage, or everyday expenses. They can do with the money as they see fit. Plans pay the cash benefits per covered person. Your customers would receive 100% of their chosen benefit amounts for their first ever diagnosis of life-threatening cancer, coronary artery disease, or cardiac arrhythmia resulting in a heart attack, or cerebrovascular disease resulting in a stroke. Your customers would receive 25% of their selected benefit amount for their first ever diagnosis of coronary artery disease or cardiac arrhythmia resulting in a coronary bypass. They would receive 10% of their selected benefit amount for their first ever diagnosis of coronary artery disease resulting in coronary angioplasty. Additionally, if the plan pays a partial percentage of the selected benefit amount, the remaining benefit amount is still available in case your customer receives a first-ever diagnosis of a different covered illness. Let's look at an example of how a cancer and heart stroke plan combined with one of Allstate Health Solutions' short-term medical PPO plans can help one of your customers. Oscar goes in for a routine colonoscopy and finds out he has colon cancer. He has a $50,000 cancer and heart stroke plan. He also has a short-term medical enhanced PPO plan with a $5,000 deductible and 100% coinsurance. Oscar's treatment costs a total of $29,196. His short-term medical PPO plan covers $24,196, or his treatment cost minus his $5,000 deductible. Oscar's cancer and heart stroke plan pays him a lump sum benefit amount of $50,000. After he uses his cash benefit to pay his deductible amount, Oscar is left with $45,000, which he uses to help with his everyday living expenses. Medical bills can start adding up when someone starts treatment, and time away from work can make it hard for them to keep up with their other expenses. Cancer and Heart Stroke's cash benefits can make a significant difference in your customers' lives, allowing them to focus on their treatment and recovery instead of worrying about how they will pay their bills. Let's discuss Cancer and Heart Stroke's plan details, including eligibility requirements, state availability, limitations and exclusions, and enrollment and payment options. To be eligible for our cancer and heart stroke plans, the primary applicant and spouse must be between the ages of 18 and 64 at time of application. Dependent children are eligible for coverage on their parents' plan. However, there are no child-only plans available. Cancer and heart stroke policies are renewable to age 75. Standard issue cancer and heart stroke policies require customers to fill out a health history questionnaire at the time of application. It is important to note that customers must answer all underwriting questions honestly. Any false, inaccurate, or misrepresentative statements on the enrollment form may result in claim denial, premium changes, or contract rescission. Cancer and heart stroke is available in the states shown on your screen. We are always adding states and new products to our portfolio, so remember to read your broker alerts for the most up-to-date information. There are some limitations and exclusions associated with this cancer and heart stroke product. Please keep in mind that this is not a comprehensive list of limitations and exclusions. Refer to the product brochure for a more comprehensive list, but always refer to the policy contract for a complete listing. Limitations and exclusions include the following: 24-month pre-existing conditions, cancer diagnosed within the first 30, 60, or 90 days of the plan enrollment, depending on the state, heart attack or stroke occurring within the first 30 days of plan enrollment, illegal drug use. Your customers can enroll in cancer and heart stroke on any date, and their plan's effective date can be as soon as the next day. For their initial payment, customers can choose any date between the time of their application and before their plan effective date. Recurring payments can occur between the 1st and the 28th of every month, and acceptable forms of payment are EFT, Visa, MasterCard, or Discover. Allstate Health Solutions has some great resources and tools to help our agents with their process, and we offer useful resources for our members too. Our website, www.allstatehealth.com, is a one-stop shop for you as an agent and a resource for your customer. On our Agents and Brokers page, you will be able to access agent tools, such as your Agent Back Office, Coverage Builder, which is your quoting engine, and our YouTube page with training videos on all our products. Explore our coverage options for individuals, so you can help your customers choose the right coverage to meet their needs. Find information about working with Allstate Health Solutions and starting to build your portfolio. View and download marketing materials, such as the most up-to-date plan brochures and flyers, along with our state availability grid. On our existing customers page, we offer places for your customers to find a provider, view general policy documents, submit claim forms, and access their member portal. When enrolling in our cancer and heart stroke or any other product from Allstate Health Solutions, your customer must review the application and billing authorization and provide an e-signature, attesting to their underwriting. Customers who complete their application on their own do this during their application process. Customers who agents assist through their application and submission process must do this via the member portal. As soon as you or another agent click Submit on the application, the customer will receive an email or text message containing a link to their member portal at www.myallstatehealthsolutions.com. This is where they will review their application and billing authorization and e-sign. When the customer logs in, they will be prompted to read the authorizations and provide an e-signature as verification. This process will take customers just a few short minutes. Members can also view all their policy documents and plan information, check current and past payments, as well as their current payment method, and download temporary ID cards through their member portal. Cancer and heart stroke is a strong product to add to your portfolio. To quickly recap, plans pay a lump sum cash benefit for the first ever diagnosis of a life-threatening cancer, heart attack, or stroke. Dependent children coverage is available. There are a wide range of benefit options available from which to choose. Customers choose to see any doctor or go to any hospital without network restrictions. Finally, cancer and heart stroke is available in a large number of states. So why Allstate Health Solutions? Allstate Health Solutions has roots dating back to 1939. We have been given an A+ rating from AM Best, indicating we are financially sound, and we are specialists in short-term medical and supplemental insurance plans. If you have any questions regarding our cancer and heart stroke product or any other Allstate Health Solutions product, or if you have questions about becoming contracted with Allstate Health Solutions, please contact the email address on your screen. Thank you for your time, and have a wonderful day.